Hello, good afternoon, everyone. Welcome to our latest ARC Talks webinar. We have today's topic is on Medicare and the evolving financial landscape. We are honored to have Sylvia Gary, who spent her career developing outreach initiatives and has been conducting Medicare trainings for over 20 years. She's a program training specialist at the Center for Medicare and Medicaid Services, CMS, where she's developing and cultivating, maintaining partnerships with community-based and grassroots organizations to promote awareness and knowledge of Medicare and Marketplace so that they can effectively assist people with both Medicare and the health insurance marketplace. Today, Sylvia will discuss the Medicare basics, how to choose a plan, what to do about coverage gaps. She'll also address some of the recent legislative changes, such as the IRA, Inflation Reduction Act, and the Home Infusion Act, and consider how those changes may affect patients with amyloidosis. We're going to conclude with a Q&A session, and so you'll see there's a Q&A button at the bottom of your screen. If you tap on that, it will open a box. At any point as your questions arise, type them in, and then at the end, we'll have time to answer those. Just a quick introduction to ARC. Sorry, I'm not now able to get my mouse to move. Let's see if this works. So the ARC, the Amyloidosis Research Consortium, is a nonprofit, patient-founded organization, nonprofit, and I am Isabel Lusada, failed to introduce myself, the CEO and founder of ARC, a patient myself. And the mission of ARC is really to improve the landscape for all patients with amyloidosis. We have 4 areas that we're focused in our work in. One is improving the speed and accuracy of diagnosis. One is increasing the science and understanding of the disease. And then the third area that we work in is around accelerating regulatory approval and reimbursement of new treatments as they come on board and get developed. And lastly, and our talk falls into this 4th area, is enhancing the care and quality of life of patients and caregivers throughout their journey with amyloidosis. If you're armed with education and knowledge, it can really help you as you navigate what's really a complex, challenging disease. I'd like to just thank for a moment our sponsors who generously sponsored this series of webinars. And now, without further ado, I'm delighted to hand over to Sylvia.
All right, thank you so much. We're going to go ahead and get started. Let me share my screen. So if you would stop sharing, I can share mine.
Well, that's refusing to let me stop sharing. I think, can you boot me off? Sorry, I don't know why it went. Let me just see if I can get
No, it says I cannot share while the other's sharing. Just 1 second, guys. All right, here we go. What are you seeing? Are you seeing my notes or are you just seeing the slide?
Just the slide, Sylvia. Oh, now the slide's gone, but if you can,
Okay.
it was
Let me try again.
fine, yeah. Oh, now we see your notes.
Okay, that's what I thought. Sorry, friends. How's that?
Perfect. Thank you.
All right, well, let's get started. Let me hide this. Okay. All right, again, like they had mentioned, I'm Sylvia Gary with the CMS office. I'm in the National Training Program, so we do conduct trainings throughout the year on Medicare basics, and then specifically on certain healthcare topics or initiatives that Medicare is involved in, and also including the health insurance marketplace. But let's just do an overview of the Medicare program in general. Then we're going to top a little bit into prescription drug benefit, looking at Medicare Part D specifically. I'm going to pull up the plan finder on Medicare.gov that will allow us to go ahead and enter some medications. And there you can see the new Medicare prescription payment plan option and also see the reflections of how the Inflation Reduction Act are impacting Medicare Part D coverage. And then I've got a couple of notes on the Home Infusion Act and just what Medicare therapy guidelines are offering for home infusion therapy that Medicare is offering up. And then we also, if you have any questions and answers, question and answer series, we'll go through those as well. If we can't address your question today, don't worry, I've got some people lined up. If it's about a particular issue that I'm not familiar with, don't worry, I've got somebody to help address that for us. All right, with further ado, let's go ahead and get started with Medicare. So really what we're going to look at here is the Medicare program. And as if it seems like I'm going by quickly, just go ahead and type that into the Q&A or the chat feature. But I'm just going to do some brief overview of the Medicare program. All right, Medicare is really health insurance for those age 65 and older. So a large population of that Medicare population has aged into the program. But we also have some people who are under 65. There's a 2-year waiting period with Social Security to qualify for Medicare if you're under the age of 65 due to a disability. And then if anybody who has end-stage renal disease, so they've got permanent kidney failure, they're on dialysis, or waiting on a kidney transplant, then they'll qualify for Medicare outside the age of 65. Now, who's responsible for Medicare is really going to be concentrating on Social Security to enroll into Medicare. If anybody's a Railroad Retirement Board member, the Railroad Retirement Board handles all retirees' enrollment into Medicare. Federal employees go through the Office of Personnel Management, but it's all administered by me, the Centers for Medicare and Medicaid Services. The majority of the population really works with Social Security to enroll into Medicare, but all of the administration, the policy, the benefit, all of that is going to be handled by Centers for Medicare and Medicaid Services. When I began my career with Medicare, we talked about Medicare in 2 parts. Now we've expanded into 3 parts. We've got Medicare Part A, your hospital-based coverage, anything in an inpatient setting. Medicare Part B is medical insurance, so anything in outpatient setting, doctor's office visits, lab work, flu shots, mammograms, preventive health benefits, that's handled under Medicare Part B. And then we now have prescription drug coverage. Almost less than 20 years ago, we introduced prescription drug coverage as an option to get Medicare prescription drug coverage for both brand name and generic medications. When you enroll into the Medicare program, though, you have options in how you'd like to get your coverage. It could either come through the original Medicare model, which is a fee-for-service option, where you select Medicare Part A, hospital coverage, Part B, medical coverage. You can add drug coverage if you don't have any. You can also choose to have supplemental coverage, and that could be in the form of a supplemental insurance policy like Medigap Policies, or you can even use coverage from a former union or current or former employer. And even Medicaid, the state insurance for those with limited income and resources, could get Medicare supplemental coverage through that. So again, fee for service means Medicare pays for a portion of the claim. You're responsible for paying for either the deductible and or the co-insurance for that particular claim. Your other option is Medicare Advantage, which is sometimes you see as Part C. This is really a managed care option where you'd work with a health insurance company, all vetted by Medicare. You get coverage both Medicare A and B, and you have to have both to get Medicare Advantage. You can add prescription drug coverage if you do not have coverage as well. And most Medicare Advantage plans offer prescription drug coverage as well. A big draw of Medicare Advantage plans, and you'll see that now with all of the marketing that's occurring now during the Medicare's open enrollment period, is that Medicare Advantage plans offer extra benefits. What's extra? Well, sometimes it's gym membership, transportation services, hearing, dental, vision, things that Medicare does not pay at all. A Medicare Advantage plan, along with an extra premium for that particular plan, offer those extra benefits. But each plan is going to be specific. And you'll have to look at the plans that are offered in your area and what their extra benefit package is going to include. Majority of the population enrolls into Medicare through Social Security. Again, it's automatic for those that are already drawing Medicare, drawing Social Security benefits. They're already under 65. We know they're aging into Medicare because they had that 2-year waiting period. They'll automatically get Medicare, and they'll get a Welcome to Medicare package in the mail. Everybody else will have to take action to sign up for Medicare, and how they're going to do that is working with Social Security. They can apply for Medicare 3 months before they turn 65. And then, of course, their coverage begins effective the month that they turn 65. Now, sometimes people get confused about Social Security aging and Medicare aging. Medicare is still 65. Social Security could change. You could retire or draw Social Security benefits at age 67 or 68. Medicare is still at age 65. Here's an example of the Medicare card. It's a red, white, and blue card. It has the entitlement dates of hospital Part A coverage, Medicare Part B coverage. What's clever is that if you have other healthcare coverage, you don't have to take Medicare Part B when you're first initially offered, as long as you have other healthcare coverage, either through a current employer, then you can elect to take Medicare Part B later and not get penalized. And when you get that packet in the mail, they give you this information in a booklet that tells you, get ready for Medicare, and explains to you the next steps on whether or not you need to take Medicare Part B, and then the steps to kind of, modify that if you don't want. What's clever too is that you can also print out a copy of your Medicare card if you lose it, or you want to look at your Medicare card, you've misplaced your Medicare card. You can visit Medicare's website at medicare.gov, create an account, and actually print a replacement card. But of course, you can always request another one from 1-800-Medicare. Okay, so we've got those individuals who are automatically qualifying for Medicare. Everybody else will have to enroll directly on themselves. And they have key time frames for that. The first is the initial enrollment period. Then you have special enrollment periods and general enrollment periods. That's if you don't already have Medicare. If you already do have Medicare, this is the time to make any changes between October 15th through December 7th. This is the open enrollment period. And right now you're going to see a lot of ads, enrollment banks that are happening in your community where you can make changes to your Medicare record. If you'd like to add drug coverage, change drug plans, change Medicare Advantage plans, this is that time that you would do that during the open enrollment period. Of course, we also have a Medicare Advantage open enrollment period that allows you to make changes if you picked a Medicare Advantage plan in the new year. You're not quite sure if this is the right fit for you and you want to go back to original Medicare, we will allow you to do that in the first 3 months of the year. Let's look at the initial enrollment period. Again, it's a 7-month window. It starts 3 months prior to the age of 65, the month that you turn 65, and 3 months afterwards. What's clever about this too is if your birthday is the first of the month, you could be qualifying the month before. But again, this is the initial enrollment period. If you missed your opportunity to enroll into Medicare during this initial enrollment period, your next opportunity is going to be the general enrollment period. We also have special enrollment periods that take advantage of as well. Okay, here's one, special enrollment periods. Say you decide to delay your Medicare enrollment because you have group healthcare coverage due to current employment. Not coverage from a former employer, but current employment, whether that's on you or your spouse. You could elect to have Medicare Part B later and not face a late enrollment penalty. And that continues for 8 months. When you decide to retire or lose that coverage, you can go ahead and pick up Medicare Part B without any kind of penalty, as long as you do it within 8 months. Now, what's interesting too is if you've missed this opportunity and you said, well, you know what, I'm okay, I'm pretty healthy, I'm not going to take Medicare Part B, or I thought I was covered under a former employer, and that's not the case, then your next opportunity is the general enrollment period, which happens the first 3 months of the year, January, February, and March, and becomes effective the first day of the next month. This is the big change because a couple of years ago, we saw that it used to be effective July 1st, and now it's effective the first day of the next month. Here you can sign up for Medicare Part A if you have to pay for it. You can sign up for Medicare Part B or get Part D if you do sign up for Medicare Part B. This is your chance to really kind of make sure that you've got your Medicare record complete. And here's how they also assess the late enrollment penalties. Just going to talk a little bit about right now during this key time frame is the open enrollment period. Again, it's October 15th through December 7th. This gives us a chance to kind of compare plans, review your annual notice of change that you've gotten from your plan. If you currently have a Medicare Advantage plan, you can look at that plans directory, look at the formulary, see if they've had any changes that you might want to change plans during this time frame. You'll also see on the prescription drug coverage side, if any changes occurred in terms of the dollar amount of what the monthly premium is, what the out-of-pocket cost is, if a prescription has gone into a new tier, maybe perhaps a higher tier. Here's where you'd make those changes between October 15th through December 7th. It becomes effective the first day of the next year. And again, I mentioned the Medicare Advantage open enrollment period, which is again every year, January 1st to March 31st. It's either to decide if you like this Medicare Advantage plan, or maybe you want to look into joining a Medicare Advantage plan and changing. This is your chance to do that now. And if you're newly eligible due to Medicare coverage, again, it's the first 3 months. You can always switch to another Medicare Advantage plan or go back to original Medicare and join a prescription drug plan. That gives you the option to protect you. All right, I'm going to skip. Well, let me share this just really quick though. Special exceptional circumstances. I've seen this quite a bit, and different people have different reasons of why they didn't take Medicare Part B or didn't enroll into Medicare. Emergency or disaster, we're seeing a lot of that. Flooding, hurricanes, that impacts somebody's ability to go ahead and pick a Medicare plan. That's not the focus at the time. If you're formerly incarcerated, now you have the option to choose Medicare Part B, look at your Medicare options now that you're out of the Federal Bureau of Prisons or any other kind of incarceration. I've seen this quite a bit. You get inaccurate or misleading information from their health plan or employer. Sometimes there's some confusion, or what you thought you were signing up for. Say you thought you were joining a Medicare Advantage plan, but it turns out you joined a prescription drug plan. That could throw some people off, or they thought they were getting a Medicare Advantage plan. They're choosing a Medigap policy. So again, protections are placed for Medicare people with Medicare to get the right insurance that they need. If you lose Medicaid coverage, we saw with the public health emergency how a lot of individuals were on Medicaid, and they decided to leave everybody alone who was on Medicaid until after the unwinding of the public health emergency, and maybe they've lost that coverage through the state. Now they have the option to make sure that they've got their Medicare record complete. And then other exceptional circumstances, things can happen, and again, those protections are placed on there. If you're interested in learning about how you can kind of learn more about your options be due to an exceptional circumstance, you can always call 1-800-MEDICARE and just kind of explain your scenario, and then they'll kind of open up the option of whether or not you can choose Medicare A or B outside of the time frames. All right, I'm going to skip a couple of these slides just for the sake of time to kind of address what we're looking at here. But there are some other special enrollment periods you can learn more about at medicare.gov. That outlines all of the special enrollment periods, and it could be as leaving your employer coverage. It could be that the plan leaves your area, or even if you move out of the service area, say you decide to relocate towards family members, and that means that you're out of that service area for that plan. We want to get you the right plan based on your healthcare needs, and also you're choosing a new service area. All right, let's concentrate on what the Medicare coverage is going to be for both Medicare A and B. Everything in the inpatient setting is covered under Medicare Part A. Semi-private room, meals, nursing, any drugs while you're treated in the hospital, and other supplies and services. Also, inpatient care can result in skilled nursing facility care as long as you have a related 3-day inpatient hospital stay. Medicare Part A also covers blood coverage, hospice coverage, and care in a religious non-medical health care institution. But the cost is a little bit different in how you pay for Medicare Part A, not only the monthly premium, but also the out-of-pocket costs associated with hospitalization. Now, most individuals do not pay a premium for Medicare Part A. And the reason why they've paid into it through their FICA taxes, and they can draw that that monthly premium, they don't have to worry about not paying for it if you have a spouse that has worked at least 10 years as well. Anybody else who has to pay for Medicare Part A typically is new to the country. They don't have the work history that allows them to get premium-free Medicare Part A. They'll have to pay a sliding scale of how they're going to pay for that Part A premium based on the number of hours that they've worked, their work history. Social Security is the key agency here who can determine whether or not somebody's getting premium-free Medicare Part A. The out-of-pocket costs for Medicare Part A really looks at benefit periods. It really begins when you're first admitted into the hospital and you no longer receive care in a hospital setting for 60 days. Under Medicare Part A, under original Medicare, you'll pay a deductible, and in 2024, it's $1,632. And then for days 61 to 90 in the hospital, it's $408 per day. For days 91 to 150, looking at $816 per day. And these are lifetime reserve days. And then all costs after 150 days. Now, discharge planners are very aware of these key time frames. And what's important to note about a benefit period is maybe this is when you'll see some people getting transferred to skilled nursing facility or exploring home health care options as an option for them. What's important to note about a benefit period is that they span calendar years. If you're admitted to the hospital in December, you get discharged later that month, you have to go right back the next month, January, a new year, you're still in the same benefit period because you've not been without 60 days in an inpatient setting. The benefit period is also clever because say you're admitted to the hospital on October 1st and you get discharged October 8th. You have to go back to the hospital December 30th. Well, that's well over 60 days that you've been admitted into the hospital. You'll have to meet the deductible all over again. So again, it's broken up into benefit periods. There's skilled nursing facility benefit periods for days 1 through 20. For days 21 to 100, it's $204 per day. The average stay in a skilled nursing facility is 2 weeks. So, but again, you can choose to stay in the hospital longer. You may have to pay all costs for days 101 and beyond. And as you can see here, Medicare does pay for under Medicare Part A, home health care services, hospice care, and blood as well. Majority of hospitals do not charge blood because they get their blood from a blood bank. But just in case, they may ask you, if we have to buy blood for you, we're going to either have you pay for them or possibly have them donated by you or somebody. And the benefit period just kind of goes into, begins the day you're admitted into the hospital and ends when you've been at home at least 60 days in a row and not in a hospital setting. Okay, let's look at Medicare Part B medical coverage. So Part A is all on the hospital inpatient side, although they include home health care as well as in hospice coverage as well. But Medicare Part B is your medical coverage. These are your doctor's office visits, your outpatient services, any lab work you might have done. If you require durable medical equipment like a walker or hospital bed, all of that is handled through Medicare Part B. What's important to note too is Medicare also offers home health services, preventive health services as well. There is a list of Medicare preventive health benefits. Majority of them have removed the out-of-pocket cost for Medicare Part B. You do not need to meet the Part B deductible to get a lot of these preventive services. There's some that do have costs, and some of these preventive services even include qualifying criteria to get them. Not everybody's going to get the abdominal aortic aneurysm screening, but they can work with their doctor to see if they qualify for it. The same with lung cancer screenings based on your smoking history. But again, colorectal cancer screenings are available to everybody. Flu shots, hepatitis B shots based on certain history. To get a good understanding of Medicare's preventive health benefits, visit Medicare's website, and you can get the list as well as the frequency and also what criteria you would need to qualify for Medicare Part B preventive services. In 2024, though, the monthly premium for Part B is $174.70. They've not released the 2025 rates just yet, so we're really sitting here waiting in the next couple of days or so. They shouldn't be releasing them. But some individuals will pay less than $174.70, but some may pay more. And it's all going to be based on their tax return from 2 years prior. Medicare Part B's monthly premium is calculated by looking at your modified adjusted gross income from 2 years prior. So as you can see on this chart, though, Medicare pays, the Medicare Part B premium is $174.70. That's the standard premium. But if you have a higher income bracket, it could go up. And it depends on whether you're filing individual or joint tax return and the dollar amount of that modified adjusted gross income. So it can go as high as $594 a month per person. So it's not like you're going to be paying $594 because you're married, you're a couple. It's per person who's on Medicare. And look at that third column, file married and separate tax return. What they're saying here is if you're filing like that and you've got $103,000 or less, then you're going to be paying $174.70, the standard Part B premium. But if you're filing above 103 but less than $397, it can jump to $559. And all of this will change next year because they will look at your 2023 tax return to determine what you pay in 2025. Now, this income-related monthly adjustment amount goes back to the Medicare Trust Fund to fund Medicare so that there's a Medicare program further down the line. What you don't see here is that you can always appeal this. You can ask for Social Security to do a redetermination because perhaps this is when you were working. This is the income that you had, and now you have since retired, and that's not your monthly. That's not your income that you have to maintain that. File with Social Security and ask for a redetermination. And again, this is going to change year to year. All right. The Medicare Part B monthly premium we saw, the deductible is $240 this year. And then typically under original Medicare, you pay Medicare pays 80% and you pay 20% for your any services and claims. And the Part B deductible will apply for some of these. Okay. Let me jump to Medicare Advantage plans, and then we're going to concentrate on prescription drug coverage. But I want to highlight a little bit, and you'll have this slide deck with you so you can have this as a reference for you. But Medigap policies help fill in the gaps of what original Medicare does not cover. So they just pay that 20%. Medicare Advantage plans do not work with Medicare Medigap policies. There are two different options, whether you choose to have original Medicare with a Medigap policy. This is a supplemental coverage, or Medicare Advantage, which is basically just your Medicare coverage through a private insurance company. Let's look at prescription drug coverage as well, and we'll go right into the plan finder, and then I'll come back and look at Medicare Advantage as well. Okay, prescription drug coverage. They say it's an optional benefit, and it is optional because you might have drug coverage through a former employer or a union. That coverage, as long as it's as good as Medicare, you don't need to take a Medicare Part D plan. They are run by private companies, so all of them have been vetted by Medicare. We pull that formulary, they submit that contract bid. We'll go through side by side and look to make sure that they've got enough drugs in each therapeutic class. We make sure that they have enough pharmacies to distribute these medications. So again, everything is going to be run by a private company, but Medicare is looking at each and every benefit of it. You can get drug coverage through a Medicare drug plan, a Medicare Advantage plan that does offer drug coverage. And really, here's how it works. You choose the plan and join it. So I can't tell you, oh, go ahead and sign me up for Medicare Part D. You'll have to find the plan based on what drugs you're taking, the pharmacy that you go to, your geographic area. If you don't choose Medicare Part D and you do not have coverage as good as Medicare's, then you will face a penalty, and that penalty is a lifetime penalty. And again, we're looking at each drug. There's not any kind of like closeout. They can't say we're not going to cover these particular set of drugs because that would, alienate a huge population of Medicare. So it's 2 drugs in each therapeutic class, both brand name and generic drugs. If the plan is pulling a drug off their formulary, they have to notify you, and they'll have to tell you, hey, either this is being pulled by, it's being pulled in general from the market, or they've decided to make a change. You'll have to be notified in a timely manner. And you also have the option of using what pharmacy you want to go to. But I'll just tell you right now, if you do your homework and find the pharmacy in your area that's a preferred pharmacy, then odds are it's probably a lower out-of-pocket cost. And we have programs for those limited income and resources. based on your criteria, you could qualify for the extra help program, which would then assist you in paying for Medicare Part D premiums and the out-of-pocket costs for some medications. Here are the costs for 2024. When choosing a Medicare Part D plan, you'll have a monthly premium. You will also have a yearly deductible, co-insurance, co-payment, and then they'll break down how you're going to be paying for that particular percentage. Now, as you can see, the coverage gap has gone away. So we no longer have the donut hole, but there is a percentage of the cost while you're in this particular gap that we saw. And then there's no co-insurance after you spent $8,000. Now, this is 2024. In 2025, I'll tell you a little bit more about how that's going to work when we look at the plan finder. Very similar to Medicare Part B, the IRMA amount from Medicare Part D is added on to your plan's monthly premium. But again, like I had said, that you could submit asking for redetermination with Social Security if you feel like this is not based on your income that you have now. There's a late enrollment penalty. It's 1% of the national base premium for every month that you did not have Medicare Part D coverage and you were eligible for it. So it can be 12% a year, and that gets added on. And every year they determine that monthly amount. So in 2024, they're looking at $34.70 as the national base premium, and then that adjusts every year. Okay, now I'm going to visit Medicare Plan's website at medicare.gov, and it's called Choosing a Medicare Part D Plan. So let me do that now. So let me escape this, and I will share the screen. Okay, can you see the screen?
Yep, that's perfect.
And okay, great. All right, let's look at Medicare.gov. So as you can see, they're already giving you that alert. It's open enrollment season, find plans now. Here's how you're going to go ahead and do that. Now, you can always work with a agent or broker. You can also work with a partner or a community member with the State Health Insurance Assistance Program. But I'll tell you right now, if you're internet savvy, you can probably do this pretty quickly. I'm going to select Find Plans Now. Since we're not doing a specific account, but if you have a Medicare account, you can always log back into your account and they'll pull up your drug history from years past. But again, if you're just want to do a general search to see what's available in your area, you can continue without logging in. And we're looking for coverage in the year 2025. And I'm going to type in my zip code. Okay, I'm going to move this screen so I can see it better over here. Okay, no, thank you. All right. So as you can see, I'm going to look for a Medicare drug plan.
We're now seeing your desktop.
Thank you for sharing. Okay. Let me go back and share that back. Okay. Is that better?
Yep, that's great.
It's because I selected screen two. Okay. So now we're going to select Medicare drug plan. We can also search for Medicare Advantage plans as well. I'm going to find a plan. It asks me, do I get any help with Medicare health plans? Am I getting anything from Social Security income, supplemental security income? Am I getting Medicaid? Do I have Medicaid, Medicare Savings Program, or even extra help? These are programs that help you really identify whether or not you're going to get some assistance in paying for out-of-pocket costs. So let's say I don't have any help. I'm going to continue on. Do you want to see your drug costs when you compare plans? Definitely. All right. Let's type in a medication that that might be impacting this group. What's a medication we can type in?
Yeah, I would suggest Vyndaqel.
Okay, let's spell it out really quick.
Vynd. Oh, God, I'm
I see it.
Yep.
All right, we're going to add that drug. Well, how often do we take that a month?
Daily.
Daily, okay.
And 4 capsules daily, so it's 80 milligrams daily.
Okay, well, that's not letting you pick 80. So, daily, so 20. So 4 times 3, so okay, 120. So we've got 120 every month. So I'm going to add it to my drug list. Is there any other drug we want to add?
I think that's probably good.
Okay. All right, back to my drug list. Done adding drugs. Okay. Based on the zip code that I selected, which I put my dad's address, what you can do here now is you can select the pharmacy. Now you always have the option of doing a mail order option. So I'm going to select that because I want to see what the costs are for mail order. And then we'll look at, say, a couple of different pharmacies. So CVS, I'll pick the grocery store, and let's put one of these other pharmacies that are probably very specific. Sometimes they do compound drugs or other things like that. All right, I'm going to be done selecting those different pharmacies. And here's how we're going to see what plans are going to be available in my area that are going to cover that medication. So as you can see here, the first plan that comes up is Cigna HMO plan. So this is a Medicare Advantage plan. I want to look at, I'm going to do a filter and just only look at drug plans. Okay, the drug plans, it shows me 10 out of 15 in my area. 15 plans I can pick from here on this first page. And as you can see, the first one is a prescription drug plan. Now, WellCare's value script is a $0 premium plan, but the total drug and premium cost for 2025, because of the Inflation Reduction Act, we have a $2,000 cap on medications. As you can see here, it says retail pharmacy and mail order pharmacy. It's still $2,000. They do have a drug deductible of $590. So let's look at the plan details here. Okay, with this particular plan, you'll have a 0 premium, but again, look at that cost. You do have a deductible of $590. The pharmacies that I selected, one was Preferred, Tom Thumb, CVS is Preferred Pharmacy. Zenith Pharmacy is not preferred, so that's out of network. And then, of course, the mail order option. Let's look at the yearly drug costs. As you can see, when you look down here, looking at that one particular medication, Vyndaqel, as you can see, the Tom Thumb Pharmacy, CVS, they all are saying that's $2,000. Because why? That was the cap that we're seeing in 2025 in terms of out-of-pocket costs for drugs. Zenith, which is out of network, look at the cost of that medication, $321,580. And then, of course, the mail order option. So if you are interested in saying, say that means that this January, I will have to pay $2,000. But then I'm set because I've got the out-of-pocket cost at $0 the rest of the year. But if I'm taking other medications, then again, that's going to throw it off as well. But we all are introducing the Medicare prescription payment plan, which is, this is an option that allows you to just kind of spread out the cost of that medication throughout the year based on the drugs currently right now on this plan finder that you're doing. So let's look at that and you can see what the drug costs are going to look like. So if I decide to do the payment plan, it's basically, I'm not going to say like a layaway, but it's just basically, it just breaks down that cost. So for this particular drug only, I'm looking at $166.67 every month. So it spreads out that $2,000 throughout the year. You can do it without and just pay $2,000 early on in January, and then you're set for the year. What's interesting about the Medicare prescription payment plan, it's not like a cost savings to you. Don't think of it as, oh, I'm going to save some money. No, it's just breaking down the prescription payment plan throughout the year. You may have additional prescriptions later on that might be having to be addressed. That could be added into this, so that will throw off the dollar amount. But again, as you can see with the Inflation Reduction Act, it does specify total drug cost and premium cost and how that's calculated. And then let's look to see how it is with a Medicare Advantage plan. So I'm going to select a Medicare Advantage plan. And like the first one said, Cigna. I'm going to do a comparison. So we'll add this to compare. And it's to AARP. And you can compare 3 plans side by side. Okay. So this is an overview of the health benefits at the top. So it talks about the health deductible, the drug deductible, some other additional services. Remember we mentioned before, Medicare Advantage plans offer additional benefits like vision, hearing, and dental. So those are broken down. You can see they're side by side. You can compare each one. The out-of-pocket cost for seeing a doctor or specialist, the out-of-pocket cost for benefits. But I'm interested in learning about the prescription drug benefit part. Okay. Similar to here, right here, it says it, $2,000 preferred in-network, mail order option, as you can see here. And then even tells you, like, if you are picking a pharmacy that's right next to your house, but it's not in network, and you've selected it, it gives you the option of finding preferred pharmacies in your area. And it just kind of gives you a discussion on that. After you've seen all of these options, you can always choose to enroll directly, or you can just get further information. And you can also visit their website directly because they might have some insight too. And you might want to call them up if you've got some additional questions for each plan. But again, each one's going to have a great discussion about what they're going to be offering. But again, as you can see in the Plan Finder on Medicare's website, you can directly enroll directly with them. And the Medicare prescription payment plan here is also available for you under a Medicare Advantage plan with drug coverage as well. Now you can choose to stay on a Medicare prescription payment plan or not. You can get off of it as well. It's your choice. Was that clear as mud?
That was really interesting. We are getting quite a few questions, and I wonder if we could
let's do it. Let's
push this in. And well, the question is around so tafamidis, which is the generic name for the drug, which has 2 different formularies. One is, or 2 different types, one of which is Vyndaqel, which is the one we looked at. But it is also called Vyndamax, which means it's done as a single pill, a 61 milligram dose. That is the preferred prescription. They are actually, you know, they're the same in how they work and the effect they have. But we're hearing a lot from patients that they're finding that the Vyndamax is no longer on the formulary. And so that's a question I think we have, the majority of questions we have coming in, trying to understand that. How do we address that? What does it mean? Is that something you would find out as you search for it with that tool?
Yes. So I just selected Vyndamax. Let me share my screen here.
Right.
And as you can see, like I did select Vyndamax. Let's go back to drug selection.
Yes.
See, there's the 60 milligram one, right? And it tells you the different pharmacies that will take it in your area. So I'm going to compare it and just see what they're offering. Same thing, it breaks it down to 2,000. Let's look at the plan details. This is a Medicare Advantage plan, but let's go straight down to drug coverage. Okay, see how it is preferred network, in network. Because it's a high cost drug, you're instantly going to get into the 2,000 from the get-go. So when you're selecting drugs, you can, of course, you can always choose the brand name or the generic medication. What I like is the estimated drug cost will tell you, it breaks it down for you. Here's what you'll be paying in 2025. You won't pay more than $2,000 in out-of-pocket costs for prescription drugs. Now, whether that's a combination of other drugs or one drug in particular, at least you know that that's been set. Now, we'll see more about it January 1st, right? When everything takes into effect, if there's going to be issues or whatnot. But but the protections are there. They've already put it out there. It's on the plan finder. Plans have been notified. Pharmacies have been notified as well. But that doesn't mean that there might not be some hiccups. So be patient, file any concerns you have with Medicare.gov. If you're seeing an issue at the pharmacy, if you're seeing an issue with your plan directly. But again, the estimated drug costs are going to be listed, and you can work with specifically with your plan as well. All right, let's also address some questions that have come in because we've got about 15.
And I think following on from that, does that tell you, the question is whether that means it will be on the formulary versus available in the pharmacy? And can you find that out from using that tool?
This is on the formulary.
That is on the
formulary.
formulary.
The drug list. Yes, it's saying it's on the list.
Excellent.
But again, each plan is going to have their formulary. So that's the only thing that you can say, oh, I want this drug, but if they're not going to cover it, it'll show you that's not going to cover that medication.
Excellent. Thank you. That's really helpful to know. I know this is something that a lot of patients are.
Well, and that's a tier 5 drug, so that's, it's an expensive medication.
Yes, absolutely. So it's really exciting news for these high-cost drugs for rare diseases that the impact of the Inflation Reduction Act and the $2,000 cap a year. We've had a question from a patient who's just been prescribed tafamidis. So if they start taking it this year, that 2,000 doesn't, there isn't that cap, right, currently?
No, it becomes January 1st, 2025.
So is there anything they can do towards as we roll out of this year before that cap sort of comes in?
I mean, another option too is if I know it's such an expensive drug, either they can have it checked to see if it's on their formulary with their current plan. If it's not on their current plan, maybe the patient assistance program through that particular pharmaceutical company might offer an option as well. And of course, you can always go outside of the plan and pay cash, which is very expensive. But, every pharmacist has the option of telling you, here's what your cost is based on if we run the claim through your insurance company, or here's the cost that's paid if you do not use your insurance.
Right. And then if you have an income of greater than 75,000 a year, and you're not able to appeal for financial support, are there any other options?
Yes, you can always see if you can qualify for the Extra Help program, which is really a coverage for those that have limited income and resources. They'll get a lower cost in their prescription drug coverage. They'll have a low premium. And I think like the out-of-pocket cost for drugs could be $2, $3 per medication. But again, it's a lot more generous than, say, somebody who has Medicare and Medicaid. This is for somebody who has they're not qualifying for Medicaid state assistance. They're not qualifying for Medicare Savings Program, which helps pay for Medicare Part A and B premiums, but they do need some extra help in paying for prescription drug coverage. Look at the Extra Help program. It's also known as low income subsidy. You can file with Social Security on their website directly, and they can get some assistance in paying for prescription drugs.
Excellent. And how does this work if you're on a patient assistance program? Is that impacted? How does that work?
Well, here's how it works with some of these patient assistance programs will say they'll cover you for this particular medication because you don't have other healthcare coverage, or it's not on the plan's formula. Like each one will set their criteria of who qualifies for those plan programs. So you'll have to look at each one and say, hey, what are they offering me here? Or maybe it's too expensive for me. Maybe they'll let you appeal through that option as well.
And here's another question that's interesting. And you mentioned that some of the pharmacies had a deductible. How does that work? Is it in addition to the 2,000? What does that look like?
When they look at the deductible, it's what you're going to be paying. So like it should be wrapped up into that. I think what I recall from the true out-of-pocket cost, it's not your premium, it's the deductible and the out-of-pocket cost for those medications. So the deductible is tied into that. You'll still have to maintain the monthly premium.
Okay. Another question is, how do we know if a drug requires prior authorization or are there any other limitations on it?
It will say that on the, let me see if I can pull it up really quick. Sometimes they say each plan sets the criteria, whether it's going to get prior authorization or step therapy. You do have the option of always filing an appeal and say, hey, listen, I already know this drug is at this level is what I need. I cannot go doing step therapy. But each plan will tell you whether or not it has step therapy or any kind of prior authorization. So you can kind of select that and learn more about, you know, what's the criteria for this drug.
And here's an interesting question. Who is given that my annual copay is currently approximately 15,000, and next year if it's going to be capped at 2,000, who is absorbing the difference in cost?
Well, it's not the plan. It's coming back. I think it's coming back to the trust fund. Because those are the new changes they made with the Inflation Reduction Act. But we can follow up with that specifically.
So there is another therapy which is called Amvuttra, which is covered by Part B.
Okay.
If administered by home health is the question. And are there any costs to me on plan? And I have to say this is beyond my pay grade. Plan G or N, which I don't know about.
Okay, that's a Medigap plan. So you're going to look at Medigap policies and see what they're offering in terms of home health coverage for that. So Medicare plan, is it N? Let's see.
Yeah, G or N.
So when you look at Medicare, each Medigap policies, they're all standard policies, right? But depending on which one you purchase, A through N or whatnot, they'll set the criteria what they're going to pay for. Remember that Medigap is only paying what Medicare doesn't pay for. So typically home health infusion is going to be free if it's a home health benefit. But there are some out-of-pocket costs that could be associated with it. So if there's anything additional in, say, Medicare plan, Medigap plan N, they'll cover whatever they pick up with their policy outlines. So you have to look at that Medigap policy specifically.
Okay. And then oh, there's so many questions coming in so fast that my screen is moving at the rate of knots.
Isabel, feel free to send them all to me. Yeah.
Okay, I will. We'll definitely cluster them and send them over to you for sure. Thank you so much. There is one of the questions, which is if a drug is given in an infusion, is that covered under Part A or Part B?
It's Part B. Part B covers infusion drugs that are done at home or at an outpatient facility.
All right, and I'm going to now hop back to actually questions about Vyndamax again, and somebody saying that if they look in their region and it shows that $323,000 per year cost at every pharmacy, are they doing something wrong? What does that
mean? Let's go. Well, let's see. Did you add the mail order as an option?
All right, this is to an anonymous attendee, so let us know if you've added the mail order. And they might want to consider also trying Vyndaqel. Try zip code, here we go, thank you. 94062, and yes, added mail order.
94062. Oh, yikes. Yeah. Okay, let's see.
Thank you for sharing that.
Back to my drug list. I said Vin. I really like that it kind of populates for you. So I see. Let me clear some of these pharmacies that I picked up.
Okay, I don't know if your
zip code has mail order option, Rite Aid, Safeway. Let's see.
You want to share your screen? Is that possible?
Yep.
Thank you.
Okay, so I typed in that zip code in. I'm looking for Medicare drug plans only. So this Cigna plan is $1.80 a month. Let's look at their plan details for this particular drug. I see 2,000. Are you typing in for 2025? That might be the thing. I'm selecting for 2025.
Yeah.
That's why.
Okay.
I was like, wait a minute, what's wrong?
Does that answer? Yes, 2025, but also Vyndamax. I think we had Vyndamax. What do we type in?
Oh, I typed in Vyndaqel.
Okay, so it is available as it looks like. Yes.
Yes, it's available.
Try Vyndamax and see. That might be the difference. That seems to align.
Drug list.
Yeah. All right. So if we. There we go.
All right, let's see what's available to us. Oh, see, look how expensive it is.
There we go. So this is something.
Yes.
Yeah.
So it's not covered.
There we go.
Now we see it. I'm going to look at the plan details. Let's look at this one really quick here. So monthly premium is $115.40 a month. Okay. Not see how you were asking about what how do I know it's not covered or it's on the formulary? Look at that yellow box here. It says not covered. So Vyndamax is not covered. But the other version, Vyndaqel, was covered.
Yes. So that would be the answer, is to get the prescription changed to Vyndaqel. We will do a bit more research at ARC and come back and we'll share it with attendees of this webinar on why this is and what's happening. I know there are so many questions about so that is something we will, yes, that's something we will follow up on and be sure to keep everybody informed about.
But right there, not covered, and that's why.
All right, so I think let's move on from that. And we know I have time for one more question here. And this is a question. I will age into Medicare December 1st, 2024, and I'm choosing a Part D and Medigap now. For coverage for December 2024, will this only be good for 2024? And do you then need to sign up for coverage for 2025 separately?
Well, if you sign up for 2024, again, it's going to cover you for 2024. If you're okay with it, you stay with that same plan for 2025. So if you want to, you can do a comparison to look at what are the plans available in 2025. If you stay with the same plan, you want to know what's that monthly premium the following year going to be. So say it's $24 for 2024, but in 2025, it goes to $30. Are you okay with just transitioning over to that new plan? Okay. You'll never get kicked out of a plan. It'll, you have to physically make the call and say, I want out of this prescription drug plan. You'll never get kicked out. So any changes you make, it all handles behind the scenes. Right.
Okay, that's very helpful. So we are at time. Thank you so much. There were really interesting questions, and we will follow up with you on some, I know we didn't get to a lot of the questions that were asked, so thank you so much for volunteering to do that. And we will feed back to attendees if you, we have the list of emails, so we will share with everybody who attended. This was really helpful, and I know there's so many questions that we get, and just really valuable to have it answered by the experts rather than anyone else. So thank you very much. And everyone who's attended the webinar, if you can take a moment as you sign out to just answer, there are a few survey questions that help us make ArcTalks as good as it can be and structure for future webinars. Thank you again.
All right. Have a great day.
You too. Take care. Bye-bye.